As we have discussed ischemic heart disease introduction, what is the difference between ischemia and hypoxemia? These two topics. And little bit about the coronary circulations of heart. Now we will discuss the causes and categories of IHD. As we know that what is IHD? Ischemic heart disease. It is the imbalance between oxygen supply and oxygen demand to myocardium of heart. After all this discussion, we will discuss that what will be the effect on ECG and IHD, and that will cover the abnormalities of ECG. But for now, ischemic heart disease is the imbalanced pathological condition in which there imbalance occurs between the oxygen supply and oxygen demand of myocardium. We have already discussed this in previous lecture. Now we will go for causes and categories of ischemic heart disease. What are the causes? There are two types of causes of ischemic heart disease. Because we are well known that there must be balance between oxygen supply and oxygen demand. So the factors which lowers the oxygen supply to myocardium are the factors which are responsible for ischemic heart disease. Also, those factors which are responsible for increasing oxygen demand to myocardium are also responsible for ischemic heart disease. So we will discuss these two separately. First, we will discuss the factors which are responsible for decreasing oxygen supply to myocardium, and then we will discuss the factors which increase the oxygen demand of heart. Both are responsible for ischemic heart disease. So let's start the factors which decreases oxygen supply to myocardium. There are four factors. Main factors, there are so many factors, but four are main factors which are responsible for lowering oxygen supply to myocardium. For example, recap it, if we have left and right ventricles here, this is the myocardium of heart, and these are the coronary arteries, the left and right. It supply blood, it supply oxygen to these muscles, it supply nutrients to these muscles, and there is also coronary veins which remove the waste product from this myocardium. And I already told you the difference between ischemia and hypoxemia. Ischemia is when oxygen supply is reduced, when nutrient supply is reduced, and when the washing out of waste products produced during metabolism increases in myocardium and causes ischemia. So the factors which are responsible for lowering oxygen supply, the first and the very most important factor is atherosclerosis. We will discuss atherosclerosis in a very big detail in coming lectures. Atherosclerosis is one of the best and one of the more mortality factor of oxygen supply reducing factor. The second factor is embolism. Embolus. Do you know about embolus? When there is some air occurs in arteries. For example, if we inject intravenously and we inject some air and blood, it will cause embolism in heart and will blocks the coronary circulation. The minimum air which is required for embolism is 100 ml. 100 ml. And 100 ml is very large quantity for air. But for reducing the risk of ischemic heart disease, myocardial infarction, we accomplish or we damage the air from syringes. The third factor is, which is very important, is vasospasm. The first factor is atherosclerosis, the second is embolism, and the third one is vasospasm. These are the factors which are responsible for reducing oxygen supply to myocardium. But the most important one is atherosclerosis. And what is atherosclerosis? When there is some fatty mass aggregates in coronary arteries, and it will reduce or it will fully block the blood supply to myocardium and will cause ischemic heart disease. The second factors are the factors. Vasospasm mainly gets caused in young females. When they are smoking, when they intake alcohols, vasospasmodic. And vasospasm means vasoconstriction during night, and it will block fully the coronary arteries. And this is also known as French metals angina. We will discuss in few minutes here. Factors responsible for factors which increase oxygen demand to myocardium. The first factor is tachycardia. When the heart is pumping very rapidly, it will demand more oxygen. So the oxygen demand will be increased. The first factor is tachycardia. Tachycardia means increase heart rate. There is one other factor, I forgot it, vasculitis. Vasculitis means the inflammation of heart arteries or vessels. It also causes ischemic heart disease. For example, if I have coronary artery and epithelium gets swelled, for example, swelling occur here. This is called vasculitis, and it will lower down the blood supply, blood flow.
So why?
Due to a lot of factors. There are some inflammatory mediators in body, histamines, leukotrienes, prostaglandins that cause the inflammation of blood vessels, also other smooth muscles. It can also occur due to trauma, due to some traumatic injuries. It can swell. So this is called vasculitis, and vasculitis is also responsible for ischemic heart disease. Here, the first factor is tachycardia. Normal heart rate is from 60 to 100 beats per minute. But if we are exercising or if we are working, this rate will be increases. For example, heart rate will be greater than 100. This is called tachycardia. During tachycardia, the heart muscles contracts very rapidly, and it will demand more oxygen. So this is also the risk for ischemic heart disease. Second thing, hypertension. Hypertension means increased blood pressure. The normal blood pressure is 120 by 80 mm of Hg. This is normal blood pressure. If blood pressure is increased from 120 by 80, the heart will work more as compared to in normal peak. As I also already have discussed that during contractions the heart is working. The left ventricle works more, the right ventricle works less. So in hypertension, if the body nutrients demands increases, for example, if you are caused by some severe disease, some severe infection, if you are kidney patient, you have some renal problems, your kidney will demand for more blood, and for that reason the heart will contract more rapidly and the blood pressure will be increases. When the blood pressure increases, the heart works more, and when the heart works more, it will demand more oxygen from coronary arteries. So this is another factor for ischemic heart disease. If the blood pressure exceeds from 120 by 80. It is also increases during exercising or during workout, right? So this is another factor for ischemic heart disease. The third factor, which is very important, left ventricular hypertrophy. What's mean by hypertrophy? Increase in size. When the left ventricles increase in size, the muscles, it will demand for more oxygen. Now, for example, if I have normal heart here, this is normal left ventricle. Left ventricle, this is normal. It will demand normal oxygen demand. But if some hypertrophy occurs here, for example, it increases in size. The normal thickness of left ventricle is 1.5 centimeter, and the normal thickness of right heart is 0.3 to 0.5 centimeter, or from 0.5 to 0.8 centimeter in some books. So when this thickness is increases, it will demand for now more oxygen. So oxygen demand increases. It is also the risk for ischemic heart disease because now the oxygen demand is increases. ठीक है? तो so मैं कोई कहना हो रहे the data normal size is 1.5 centimeter, right? You can guess that the sedology, hypertrophic condition, hypertrophic due to star muscles या cell size increase. So the muscle size increase show, for example, that 2.5 centimeter allowed. That you go beyond the data para que come. Check that 2.5 centimeter allowed. No specific you general करें For example, the 20 oxygens पर एक रहते हैं 20 oxygen. अब दे दे demand पूरा तो उस दिन size 7 20 fulfill नहीं.
Yes sir.
Did about
40 पका. 40. That's a double issue. The 40 paka will mean oxygen demand increases and it is the risk for ischemic heart disease. The next factor in oxygen demand is hypertrophic obstructive cardiomyopathy. When there is some dysfunctions take place in cardiac muscles, and due to that hypertrophy take place, and due to this hypertrophy obstructions occur in heart. For example, if I have this is the myocardium of ventricle, myocardium. We have coronary circulations here. Actually, it is present here. It is present here. When there is some hypertrophic conditions take place, for example, these muscles become hypertrophic like this, and these muscles, this endocardium like this. So it will contract the coronary arteries. This is called obstructions. It can fully obstruct the coronary artery, or it can partially obstruct coronary artery. So it will cause the oxygen demand more as compared to angina, and it will cause ischemic heart disease. Go ahead. So these are the another factor for ischemic heart disease. So these are the causes of ischemic heart disease simply.
Sir, your question is.
Why? So these are the factors which can increase or which can reduce oxygen supply. The first factor in oxygen will decrease oxygen supply. Decrease oxygen supply. Remind it in your minds. The first one is atherosclerosis. Atherosclerosis, we will discuss atherosclerosis in detail because this is your topic in your syllabus.
Yes.
Atherosclerosis. And have also a lot of, there are more causes of atherosclerosis than ischemic heart disease. Atherosclerosis. What is atherosclerosis? Generally, if we have coronary circulation, for example, we have coronary arteries division, and some fatty masses occur and accumulates here. It is called fatty plaque. It is called fatty plaque. Due to this, the blood supply become reduced. There are two types of fatty plaque. We will discuss in atherosclerosis in detail, but here for categories of IHD, it is important. Fatty plaques are of two types. The one is stable, and the second one is dynamic. Mean this is stable or fixed on one side, but it can travel in coronary arteries. For example, this is stable and this one is not stable. The lead segregations are here. For example, this dynamic fatty plaque travels in coronary artery and block the branch of coronary artery. It will fully block the oxygen supply or blood supply to myocardium. This is very dangerous as compared to stable, because if stable block is 90% blocks or 70% block the coronary artery, the patient can't feel pain during rest, because 30% supply is now sufficient to heart muscles. But during exercise, this is not sufficient, and the patient will cause pain in his heart chest. But in dynamics or in movable flux, it can travel in coronary arteries all over the heart, and it can block any side of heart in any time, and it will directly cause angina and then myocardial infarction. So go ahead. Now we will go for categories of ischemic heart disease. In categories, we will divide the categories into two. IHD categories. One is angina, and the second one is infarction. Angina and infarction. And angina, it is divided into stable angina, and unstable angina. The one middle type is Prince Metal's angina, or it is also known as vasospasmodic angina. Vasospasmodic. In infarction, we will discuss two types. There are two types of infarction. The first one is endocardial myocardium infarction, which is also known as Ischemic. Non-ST elevated myocardial infarction. And the second one is transmural infarction, which is also known as STEMI. So we will go in detail for these categories. So many categories of IHD. The first one is stable angina. The second is unstable angina. The third one is endocardial myocardium infarction. The fourth one is transmural infarction. And the fifth one is transmetals angina. What is actually angina is? Any one of you?
Chest pain.
This is typical chest pain. When we are feeling pain in chest, this is called angina. So we can define angina as this is chest pain. Chest pain due to cardiac problems. General thoracic pain is not angina. Only due to when the chest pain occurs due to cardiac problems. And for cardiac problems, there are some categories. You will see the categories, and after that, you will decide that this is cardiac problems or not. So the chest pain due to cardiac problems is called angina. Now, I have already told you that there are two types of atheromas. There are two types of fatty flare. The one is stable and the second one is non-stable. For example, I have heart here. For example, this is right atrium, and this is right ventricle. And this is vena cava. And for example, this is left atrium, and this is left ventricle, and this is aorta. This is, for example, coronary circulation. This is left coronary artery, and this is right coronary artery. We will cut this coronary artery. For example, I am cutting this heart like this and zoom it on board. For example, I have this is coronary artery. This is, for example, circumflex artery, and this is LAD, left anterior descending artery, coronary circulation. And I have also cut some myocardium from heart. So these are myocardial cells. This is endocardial myocardium, this is middle myocardium, and this is epicardial myocardium. For example, this is endocardial myocardium, this is middle myocardium and epicardial myocardium. Also here we have middle myocardium and epicardial myocardium. These are 5 categories, so we will go for 5. Here, for example, I have this is epicardial myocardium, this is middle myocardium, and this is epicardial myocardium. And now, I already told you that this coronary artery is responsible for supplying of blood to this myocardium all over the heart and supplying the blood to myocardium. For example, if fats occur in accommodating here, and this is a trauma formation, this is thrombus formation, but this is normal stable flock. If the stable flock is blocking 70% lumen of artery, 70%. Yes. Lumen caused by stable angina. In stable angina, if the flock is the flock if the flock is less than 70%, 30% blood is now sufficient for oxygen demand of heart during rest. It means that during rest, this patient will not feel pain or angina, and it is not stable angina because
The blood is not moving.
blood flow is not moving, and the blood supply is reduced more in these tissues or these an epicardium side or endocardium side. Epicardial side, because the blood is near to endocardium, it will fulfill. But when the blood comes here, these tissues will not sufficiently feed, and this condition is called stable angina. Stable angina. But if the flock is if this flock greater or equal to 90%, greater or equal to 90%, the patient now got 10% blood is not sufficient to fulfill oxygen demand of heart, and now the patient will feel chest pain during rest also. Here chest pain will be feeling during exertion. Exertion means when the patient is working or walking. In rest, this patient will not feel pain. At exertion, this patient will cause pain in chest. Now we will go for another type. This is stable. This is stable angina. The flock is not moving. Here, in unstable angina, unstable flock will produce. Unstable means it can move. Actually, this movement is caused by this platelets aggregation. This is thrombus. This is flock, and this is thrombus, adhesions of platelets. It can be cut off from here and it can block other sides in heart. And this is called unstable angina. Unstable angina. And unstable angina, the flock is unstable, flock is unstable. Chest pain will be feel during rest if the flow is more than 70%, like this. Now the other type is infarction. And infarction, in this also these tissues will be affected a little bit. Sometimes these types of angina occurs and damage with time by itself, because these are not that much flux or that much obstructions in coronary arteries. But here, if we take infarction, this is unstable angina. Now, if we have endocardial myocardium infarction, it is also known as Ischemic. Now remember this point: if unstable angina prolonged for 10 minutes or for 15 minutes, it will cause endocardial myocardium infarction. From 10 to 30 minutes is normal, but 10 to 15 minutes is common. If this angina prolonged for 10 to 15 minutes, it will cause endocardial myocardium infarction. What's meant by endocardial myocardium infarction? For example, we have flux here. This is fatty flux. This is also unstable flux. The first point is unstable flux will produce. The second point, it will obstruct more than 90. Luminal obstructions will be more than 90%. And the angina will be prolonged 10 to 15 minutes. 10 to 15. So by prolonging the obstructions of blood to these tissues will become necrotic and become dead, nearly dead. There is no ST elevation in ECG. If you are go for ECG for that patient which is caused by endocardial myocardium infarction, and rather the patient feeling pain, so you will aware that this is endocardial myocardial infarction because there is no ST elevation. Now the other type is STEMI, which is called transmural. For example, here the transmural infarction, and it is also known as STEMI. Remember that in this STEMI, the ECG will be normal. There will be normal ECG. There is no elevation, no depression. But in transmural infarction, there will be ST. There will be ST elevation. This is ST elevation. So this is called STEMI, ST elevated myocardial infarction. Why this occurs? Because now the flake obstructs the whole coronary artery. This is unstable flow, and obstruction is now 100%. So the blood stops to all these tissues. There is no blood supply because now the blood is obstructed 100%. The contractions will be damaged or inhibited. So we will see ST elevation in ECG. This is called transmural infarction because the whole myocardium is affected transly. Transversely it is affected. So it is called transmural infarction. The last one is Prinzmetal's angina. Prinzmetal's angina is, for example, if you have a young female who is smoking, takes ethanols, alcohols,
Yes.
for example, and also takes fatty foods, spicy foods. There is one condition, for example, we cut this coronary artery and see it, for example, this coronary artery, we cut it and see from here cross-sectionally. So this is normal coronary artery. This is normal coronary artery. And this is myocardium. This is myocardium. Normally it supply full blood supply to this myocardium, but due to these intakes, this coronary artery constricted. For example, now this coronary artery is constricts, and it will supply low or no oxygen to myocardium, and these all cells are affected. This all myocardium is affected. In young females, this condition is common as compared to young males or adults. Normally, these conditions occur after 40 years. But in young age, this is the main factors. Smoking, ethanol intake in young females. So, these coronary arteries constricted and it will affect the whole myocardium. So, there will be unique conditions like when you diagnose ECG, here will be ST elevation. Here will be ST elevation. But profile will be negative. And now the beta blockers are contraindicated. Remember this point in your mind. Here in these females, propranolol, atenolol, labetalol, beta blockers are prohibited because it causes vasoconstriction. And this is already constricted. So we will, in treatment, we will give calcium channel blockers, and parfait we will give triglycerides. Right? So this is the treatment for these females, and the common time in which this pain occurs, this Prinzmetal's angina takes place is midnight in bed. This is Prinzmetal's angina. It is also known as vasospasmodic angina. And these are all the categories of angina or ischemic heart disease. Say so?
Yes.
That's a question.
Question.
Sir,